Well, I mean, I think that there's a number of different pieces to heart-based medicine, and one of them is the patient. And I'd like to think that when we are coming from our heart and when we are connecting with our patients, that they feel that connection, that they get into that resonance, and that ultimately their health will improve, right? If we can make them feel safe, make them feel, connected and loved, and help them to connect to that deeper, truer part of themselves, that will facilitate this whole healing process. And I think that is really that's the place of these healers that do this, right? Is they really, it's not necessarily their hands, but they're putting people into a place where they can be more deeper connected to themselves. And ultimately that's over the long term, when we're talking 50, 100 years, that we're really facilitating a self-healing to occur in people. And I think ultimately that starts with the physician. And so if we are working the hours that we're working, and we're in this sort of environment, the hospital environment with the air conditioning and the no light, no windows and no environment where we can feel, where we can be in a place where we're healthy. I mean, the hospital system isn't a healthy place for physicians. And I think it starts with that, is how do we promote health in physicians so that they don't have that baggage of that, the fatigue and the stress and all the things that are dysregulating their own systems, so that when we can help them connect to their own heart, connect to their own system and divine place, that then they can actually do the healing work. And they can do what we're talking about, which is ultimately affecting patient outcomes. But until we help physicians, which are ultimately the front line, that's just not going to happen. So where I see heart-based medicine primarily is understanding where the issues are for physicians. Where are they struggling? And then being able to support them. And I think that awareness precedes change. So first we have to bring awareness to the system and to the fact that physicians are burned out and unhappy, and they're suicidal, and they're not sleeping, and their relationships are falling apart, and their health is failing. Once people recognize and become aware of this in themselves, then we can motivate them to make the change that's necessary, which is bringing them to their heart, bringing them into a healthy space, so that then they can do their work for themselves and then ultimately affect others. And so bringing awareness, giving them some tools to do that work, to support them in doing their own healing work, in looking at the fact that their marriage and every single relationship they have is falling apart. Well, that's important. When we have people who are going home and are lonely or fighting with their spouses all the time, then that's not going to, they're not going to come to work all happy, and they're not going to come regulated and in their heart. So just supporting people in those kinds of things, they're really important. I mean, we are a species that needs others. Our whole physiology is set up to connect to others. And so really helping people connect to the people that are important to them, supporting them in that, and then also giving them tools to connect to their heart and to connect to their breathing, to connect to their body, to connect to that deeper, truer part of themselves, which is ultimately going to drive the rest and give people that ultimate healing potential for others. I mean, I think the obvious answer is to give this to everybody. I think that what we will see is that the younger generations are going to be more open to this. than the older generations. Just as the younger generations are more open to mindfulness, they're more open to the alternative therapies, they're more open to something other than the status quo because they've seen it not work. I think they're going to be more open to heart-based medicine. That being said, there are a number of physicians who are going to be saying, what I'm doing isn't working and I need help. And so not to ignore the older generation, but I think for sure we need to put the resources in place for medical students, for residents, for fellows, to start them in that process, because I think they're going to be more susceptible to it. I think, again, it's going to be perhaps generation specific. And because I've been watching this younger generation and certainly even the younger kids, under age 10, this is a generation that's coming in with an upgraded software system. They've got the iPhone 10 and we're all working on the iPhone 5. They're more sensitive, they're more empathic. They're having difficulties because of that. They're more anxious. They are more hypersensitive to their environment. But I think ultimately, because of their upgraded software system, they're going to have a different response to this. And ultimately, this is the generation that's going to move us and move the mass consciousness into a whole new space. And they are coming in already with that upgraded system. It just needs to be cultivated. So with that generation, I think that the gender differences are going to be less. Whereas I think the older generation who has grown up with a lot of chauvinism and that energy, which is objectification and sexualization, and it's very pervasive in our society, the way that it's run now. And I think as we see this next generation move through, following the Me Too movement and this awareness, right, which is preceding the change, that they're going to be more open to all of these kinds of things, and we're going to see less of a difference in the gender acceptance of this kind of approach. In answer to your question of have I encountered resistance, absolutely. Absolutely. I think the resistance to anything new, right, from an old system into changing that system, you're going to come up with resistance. And I think that there's when you start talking about the heart, especially, and love, and in fact, I don't use that word because there is, especially with the male population, as we were talking, that older male population, there is a subliminal link to sex with love. And so I'm very conscious of that link, and that I don't use that word love because I know that that thinking brain is going to start going down that road, and that's not what we're talking about. We're not talking about romantic love. And so when you start talking about the heart and about heart-based qualities, people tend to think it's woo-woo. Now, I do think things are shifting with the mindfulness movement. People are becoming more accepting of self-awareness. And I think those are the building blocks for what's to come next. Because without self-awareness and acknowledging that I'm not in my heart and that I'm frustrated and angry and enraged, without that self-awareness, I can't change. And when I have that self-awareness and I have the tools that can help me to self-regulate, better self-regulate. And knowing that when I do that, I'm a better person, I'm a better doctor, I'm a better mother, I'm a better wife, I'm just overall a better person, that that's who I want to be. And that is my authentic self. And that is my deeper, truer nature to be able to bring that out. And so I think when people start to put the pieces together, that mindful awareness and then being able to shift to who you really want to be, how do you want to show up? And having the tools to do that, I think is going to take off. But for now, I think there's still very much this woo-woo around love and care and these sort of soft feminine qualities, because we're living in a very masculine chauvinistic world. But then as that generation moves in and this sort of settles out, I think things will shift. And I think it's part of a global shift in consciousness, which is where we're going. Well, I mean, I think that this is process of people waking up, and people are talking about this, and it's in books, and what does that ultimately mean? And I think that our awareness of the world and the 3D world around us, and our awareness of self, and our connection to the rest of the world and the universe is moving into a whole new realm that's really unknown to many people. And I think when we connect to our heart, we have some tools to do that using heart math. And as I've been teaching people who have been coming to my clinic how to connect to their heart, how to become more self-aware in doing these breathing practices and shifting to this more sort of regenerative emotional state rather than getting stuck in frustration and anger and anxiety, that they're coming back to my clinic a week later, and I've had patients say, I'm waking up. Like, I don't even know what happened, but I see things differently, I feel different, my whole perspective has changed. And that is so amazing, because, and in that awakening, in that perceptive change, they get better, right? And it's not anything I've done. All I've done is guided them to their heart. And they've done all the work from there. And I think the heart, not to sound too woo-woo or spiritual, but the heart really, it's like this wormhole to our spiritual selves. And there's energetic explanations for that, and I think it's still very much esoteric. But if you just buy that piece of the heart being this window, right? We call it the window to the soul. It's a little woo-woo in Western medicine, but in so many other civilizations for the last 1,000 years, that is what the heart is. Everybody's been talking about how the heart is the window to the soul. It is. So when we connect to it and we bring awareness to it, it connects us to this other piece of ourselves and awareness of that is really shifting who we are, how our body works, people's illnesses, and how they interact with each other. And I mean, that's really what we need to do. And I kind of look at medicine and how we're going down these roads of genetics and changing people's genes, and the Human Genome Project and what that where that went, and this whole idea of we're going to rid the world of disease because we understand genes. And I just have to laugh, because until we can learn to treat each other better, it does not matter what we do with our genes, because epigenetics is going to just shift and turn things on and turn things off because we're exposed to the stress and how we're being treated, and how parents are treating children, and how we're treating each other, and the exposure to domestic violence and the exposure to gang violence. And until we learn how to better get along, disease will never be eradicated, no matter how many amino acids you're able to change. And so I think part of this is really connecting to this other authentic self that's going to facilitate that real healing, and helping people connect to that piece of themselves that's really going to do the healing for them. I mean, I worked in academic centers my whole life, my whole career, that the medical clinics are very sterile for a reason, and you've got the bench and your computer, and if you're lucky you got a window. But one of the things I really recognized was that kids, when they come to the hospital or the medical clinic, is they're not feeling safe. And when they don't feel safe, their nervous system gets activated, and they shut down, or they're hyperactive, or they act out. Their illness gets worse, their symptoms get worse. There's that whole white coat syndrome, right? And so the most important thing for me when I set up my clinic was safety. And I wanted kids to feel safe and comfortable. And so one of the things I really wanted to give them also was a place to hide. Because I would have kids, as I was talking to parents in this clinic at Stanford, I've had kids hide under the chair, right? They would get up and they would literally go under the chair when you start talking about their trauma, right? Which is a behavioral avoidance. And there's not much space under a chair. And so I put a teepee in my office. And so I have, in the sort of corner, I have this great, beautiful teepee with, lights and flags, and that's their place if they need to go and hide. And that's information for me that they're disappearing and they're avoiding this topic. I have 3 pictures of animals blowing a big bubble with their bubble gum, turquoise bubble gum, to also give it a sense of of playfulness. And I have adults too that come in and they love these pictures. And then I have 3 massive windows that look onto the trees and the sky. And you can't see the road, and you can't, you just see these big, beautiful pine trees, these evergreens, and the sky. And that connection to nature is really important for me as well in cultivating safety.
This has been a Heart-Based Medicine production. Thanks for listening.